Hi, welcome in. So today we are doing an eye exam on you for new glasses, correct? Okay, so we are just going to be doing a lens test. We're going to see which lens is better. I'm going to be observing your eyes. And yeah, let's get started. I am just going to first take this light and I just want you to follow the light, okay? Good. So, do you wear contacts or glasses already? Okay. Are you wearing any contacts now? Gotcha. All right, tell me when the light leaves your vision, okay? Mm-hmm. Okay, now tell me when the light enters your vision. Good. We're going to do the same thing, but with a different light. I have this red light, and I want you to tell me on what side you see it blink like this. So I need you to look just at my nose. Just tell me when you see it blink, either the left or the right, okay? Very good. Okay. Now I want you to tell me how many times it blinks. Okay. How many times was that? Good. We're going to do it again. Okay, how many times was that? 12. Very good. Right, I'm going to be looking at your eyes with this tool here. Just look at my nose. All right. Okay. Can you just keep your eyes wide open? Okay. I want you to look up for me. Good. Now I want you to look to your right. Very good. Now I want you to look left. And now look down. Okay. Can you blink a couple times for me now? Just blink, blink, blink. Good. Very good. Okay. I'm going to be looking at your other eye now. Same thing. Just look at my nose right now. Very good. Okay. Now I need you to keep your eyes wide open again. All right. Can you look up for me? Good. Now, can you look right? Good. Can you look left? And can you look down? Perfect. Now just keep blinking. Blink, blink, blink. Blink, blink, blink. Very good. Okay. Your eyes look good. Not seeing any redness. The veins look very healthy. So that looks really good. I have this other light. I just want you to just follow the light. Does the light bother you at all? Okay, just keep looking at the light. Very good. I'm just going to be putting on some gloves. And I'm going to be touching around your face, around your eyes. Just want to make sure that there's no lumps, bumps, or you're not feeling any pain. Very good. Now, just relax for me. You can close your eyes. You keep them open. Just relax. Actually, for this, you can close your eyes, okay? Okay. Any pain when I touch along your eyes? Okay. Everything is looking good. Not seeing anything concerning. So very good. Okay. I'm gonna cover your eye. See my hand here? Okay. How many fingers am I holding up? Good. 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 Okay. Now let's do the other side. Do you see my hand? Okay. How many fingers am I holding up? Very good. You did great. All right. I'm going to be covering your eyes with this here, and it's this tool to see if you can see these little bright lights. So just let me know when you see sparkly red lights, okay? Let's begin. Actually, okay, let's begin now. Good. Okay, very good. Now we are going to do it a little differently. So this one's going to be a bit harder. So let me know when you see the red lights. These are going to be very dim. Good. Very good. Okay. Now let's do your other eye. Start right back with that darker red. Okay. So tell me when you see the red lights. Good. 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 Great. Same thing now. This light is going to be a bit dimmer, so let me know when you see the red light. Good. Perfect. we are going to do a color blindness test, and then we'll move on to the lens test, okay? Alright, so I just need you to tell me the number you see in the circle, okay? What number do you see? What number do you see here? And here? What number do you see here? And here? And what number do you see here? How about here? What number do you see here? What about here? What number do you see? What number? And what number do you see here? What number here? What number do you see here? Very good. And what number here? Great. What number do you see here? And what number do you see here? What number do you see here? And what number do you see here? Okay. Very good. We are done with that. You did great. No concerns about color deficiency at all. You got all of them correct, even the trick ones where there were no number inside. So you did great. Now we are going to be doing the lens test, but before we do that, I just want to test your PD quickly with this tool here. So I just need you to look at my nose. We're going to use this light. Okay, just look at my nose, and if this tool ends up blocking where my nose is, just try to imagine that my nose is there, okay? All right, just stay still for me. Okay, do that here. Okay. Okay. Okay, so it looks like your PD stayed the same from last year, so no changes there. It's just important when you get glasses, it's the distance between your pupils, and that really affects how your glasses fit and how you see. So everything's good there, same as before. But yes, let's get started with the lens test. All right, so we put these glasses on you, and I am going to be putting lens here, and I just want you to tell me which lens is better. Okay, so we're gonna start off with this lens here. Okay, so this is lens 1. Okay, this is lens 1. And this is lens 2. Okay, so lens 1, this is lens 2. And this is lens 1. Okay. Can you tell me the furthest line you can read? Okay. Okay. Now let's do a different lens here. We're gonna go kind of thick here. This one's a thick lens. Alright, so we have this lens here. If I put this lens on top, does that help? No. Okay. Gotcha. What if I did this? How does that look? Okay. And what happens when I put this lens on top? Okay. So lens 1 or lens 2? Lens 1 or 2? Okay. Now, let's do lens 1. We have lens 1. Or lens 2. Oh, yeah, that one seems kind of thick. So we're actually gonna remove that one. Okay, so we're gonna put this thick lens on. Okay. Let me know. Does your vision get any better with this? It does? Okay. So, I want you to read the smallest line for me. Okay. Very good. Very good. Okay, so that's very clear for you. Gotcha. What if I did this and I did, let's see, I did this. Oh, wrong one. Sorry. Here you go. Is it clear as well? Okay. Interesting. Okay, I'm gonna remove both. Lens 1. Okay, that's 1. Or lens 2. Okay, so it's kind of zoomed in. Alright, can you read the smallest line for me? Okay. zoomed out. Okay. Can you read the smallest line for me? Okay. Gotcha. All right. Let's see here. Okay, so this is lens 1 and lens 2. Okay, zoomed in again. Gotcha. Now let's see if we can do here. So we're gonna go down 1. Okay. How's that? Okay, interesting. So lens 1, lens 2. 1, 2. Okay, so you prefer 1. Gotcha. Okay. Okay, so lens 1, lens 2. Okay, so it's zoomed in. Okay. Read the smallest line for me. Okay. I'm gonna get this here. This one's super. Okay. Can you read any lines here? Okay. So this is lens 1. And this is lens 2. Did that get better at all? Okay, a little better. Okay, this is lens 1. This is lens 2. Okay. Lens 1. Gotcha. All right. Okay, this is lens 1. Lens 2. Okay. Better. Can you read the smallest line? Okay. Very good. Both here. So this is what I think your prescription is. Okay, so I'm gonna just put the first lens on. Okay, yeah, it's pretty blurry, but I put that together. Everything looks good. Okay, can you read the top line for me? Good. And now read the shortest line. Very good. Okay, so this here is your prescription. I'm going to be writing it down for you and giving you your prescription. Okay, let me take off these glasses for you. So that is the end of the appointment today. You did fantastic. So looking at your prescription, it has improved just a bit. So we're going to give you a smaller prescription here. And if you want, you can buy some glasses with that new prescription, or you could just stay with your glasses now. They're going to be a bit stronger, but they will still work out for you. But yeah, thank you so much for coming in today. It was very lovely to meet you, and I hope you have a lovely rest of your evening. All right, I'll see you around. Bye-bye. Okay, so I'm going to be covering one of your eyes. Okay, and I want you to follow the light. Good. Just follow the light. Perfect. Can you tell me when you no longer see the light? Okay. Okay. Mm-hmm. You're doing great. Good. Let's do the other eye. Same thing. Just follow this light. Perfect. Good. Just keep following the light wherever it goes. Perfect. Okay. Can you tell me when you no longer see the light? Mm-hmm. Good. Good. Perfect. Okay, now we're going to do the same thing, but with both of your eyes. So I just want you to look at my nose. So tell me when the light enters your vision. Mm-hmm. Good. You're doing great. Mm-hmm. Okay, same thing. Just keep looking at my nose and then tell me when you no longer see the light. So we're going to start the light right here. Tell me when you no longer see it. Mm-hmm. Perfect. Okay. So I'm just gonna put gloves on quickly because I'm gonna be touching your eyes. Okay. So for this one, like I said, I'm gonna be touching your eyes. I'm going to lift up your eyelid and I'm just gonna be looking deep in your eye. So just relax. Just going to keep your eyes open for me. Very good. Just looking in your eyes. Can you look up for me? Good. Look left. Look right. And look down. Good. Now let's do the other eye. Same thing. Very good. Okay. Now, can you look up for me? Good. Look down. Look left. Okay. And look right. Beautiful. Okay. I'm gonna look one more time, but I'm gonna use this light here. Just relax. Keep your eyes open. Try not to blink. Okay, you can blink. Blink for me. Blink. Just keep blinking. Just keep blinking. Good. Okay. Now relax your eyes. Okay, now I'm going to be looking at your next eye. So this time I need you to keep your eyes open. Keep them open for me, please. Keep them open. Good. Just keep your eyes open. Okay, now you can blink, 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 blink. Okay, very, very good. I have two different lights now. I have two different lights, okay? One is what color, okay? And one is what color, okay? I want you to follow the red light, okay? Follow the red light. Good. Follow the the red light. Very good. Okay. So I want you to close your eyes now. Let me know if it's the white light that's flashing through your closed eyelids or if it's the red light. Okay? Can you sense that light over your eyelids? So sometimes you're able to see it. So just keep your eyes closed. Just let me know if you feel either the white light or the red light. Okay. All right. Do you see a light? Okay. What light is it? Good. Okay. Close your eyes. So that one was white light. Now close your eyes. And what light do you feel now? Do you sense it? Can you see it through your eyelids? Okay. So this is the red light. Very good. Okay, keep your eyes closed. Okay. Do you see the light shining through your eyelids? Okay. What color light is it? Good, that's white. Okay, keep your eyes closed. Okay. Do you see a light shining through your eyelids? Okay. And what light is it? Good, it's the red light. Okay. You can open your eyes. Okay. So I need you to follow some of my instructions now. So I have this light here and I have this light here. So I want you to look at my white light. Okay. Look at the red. And now look at my nose. Good. Okay. Look at the red. Look at the white. Look at my nose. Look at the red. Now the white. Look at my nose. Look at the red. Now my nose. Now the white light. Look at the red. Now the white light. Now look at my nose. Very good. Look at the red. Okay, now look at my nose. Look at my nose. Okay, look at the white light now. Look at my nose. Okay, look at the red. Good. Keep looking at the red. Keep looking at the red. Keep looking at the red. Look at my nose. Keep looking at my nose. Very good. Okay, I'm going to cover one of your eyes. Okay, tell me when you see the red enter your vision. Mm-hmm. 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 Good. 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 Okay. Again, other side now. Let me know when the red enters your vision. Good. 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 Very good. 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 Okay. So now I'm going to be testing the pressure of your eyes. So I'm going to open your eyes. Good. Try not to close. And I'm going to be blowing this air through it. Okay. So keep your eye open. Good. We're going to do it 2 more times. Good. Good. Okay. Let's see this one. Keep your eyes open. We're going to do it 3 times. Good. 2 more. Good. 1 more. Good. Okay. Now I need you to close your eyes. I'm just going to palpate your eyes, making sure that there's no pain. So just close your eyes. Perfect, so no pain? Good. All right. I'm going to do another test here. So we have the color deficiency test. Okay. So you're just going to tell me what numbers you see in this circle. So we're going to start with this one here. What number do you see? Okay, good. This is 12. What number do you see here? Good, that's 8. And what number here? 29. What number here? 5. And what number here? 3. How about here? What number? 15. And what number is this? 74. Now this one. 5. Now this one. 7. How about this one? Good, that's 16. And this one? 73. Okay, how about this one? Good, there's no number here. And how about this one? Good, that one doesn't have any numbers either. Okay. And now here, what number is this? Good, that's 26. And this one? Good, 42. Okay. And now we are all done with that. You did fantastic. You got all of them right. I know some of them were a bit challenging, but you did really, really good. Now, I just want to test your vision. So, we will be doing a lens test, but before we do that, we are just going to see how your vision is without any lenses. So, do you wear contacts or glasses? Okay. Are you wearing any now? Okay. So, just tell me the furthest line you can read. Okay. Yeah, it's a little bit blurry. Yeah. Okay. So, can you read this line for me? Okay. Yeah, it's a bit blurry. Okay. Well, we are going to be doing the lens test on you now. So, just relax. I'm going to get that ready for you. All right. We are able to put the lens on you. So, now we don't have any lenses right now. So I'm just going to put one on you. Okay. So let's put this lens here. Okay, so how's that looking? Is that a good fit? Okay. Okay. Let me get another one. So this is lens 1, and now this is lens 2. So how is that looking? Okay, so lens 1 and lens 2. Lens 1, lens 2. Okay, yeah, so lens 2 is a bit zoomed in. Okay, so lens 1, can you tell me what these letters are on this line? Okay, very good. let me see if I can do like a different prescription here. Maybe let's do, let's do this one. Okay, so lens 1 and lens 2. Okay, again, lens 1, lens 2, lens 1, and lens 2. Okay, so they're kind of similar. Okay, can you read this line here? Very good. Okay, so that one's pretty decent for you. Now I'm going to take this lens out, and it's going to be a little wonky here, so okay, so yeah, your vision isn't all that great, right? Okay, this one's a little different. Okay, yeah, it's kind of tilted. Okay, what happens when I add this lens? Okay, so which one's better? Lens 1 or 2? 1 or 2? 1 or 2? Okay, gotcha. Okay, so can you tell me the furthest line you can read? Okay, so this one's kind of tough. Gotcha. Okay, so we're putting on one of those lenses again. So we're gonna do it like this. Okay, so how's it looking? A little zoomed in. Okay, what if I did this? So lens 1 or lens 2? So, oh, sorry, one moment. Let me just put this in differently. Okay. Okay, so lens 1 or lens 2. So I'm putting a new lens in. So this is lens 1. So it's like really, really blurry, right? Okay. So what happens if I add this one? Did it get better for you? Okay, so that one helped it. Okay, so let me know. So how does it look? Blurry? And this one? Okay, so you prefer lens 2. So we're gonna keep these here. Okay. Can you read the shortest line for me? Not shortest, I'm sorry. The smallest line. Okay, very good. Alright, so then what happens if I do this? So, lens 1 or lens 2? Lens 1, lens 2. Lens 1 or lens 2? Okay, interesting. So it kind of zooms it out. Gotcha. Okay, can you read the smallest line for me? Okay, so it zoomed it out. All right. So then let me see here. Now, this is lens 1 and lens 2. Lens 1, lens 2. Okay. So no difference, or is there a big difference? Okay. Okay, so let me just remove these. This is what I believe your prescription is. So let's see. We have this here. Okay. And one more. Nope, not that one. Okay. Actually, here you go. Okay. Okay, so I think this is your prescription. How's it looking? Okay. Can you read this line? Good. Now read this line. And this line. Now can you read this line? Good. Read this line. Good. Now read this line. And this line. And can you read this line? Perfect. Okay, yeah, this is definitely your prescription. So now we're going to take off these lenses. So just sit back and relax. All right, we removed those lenses off you. I'm just going to get your pupil distance measurement. So just keep your eyes here at my nose, and I'm just going to measure the distance between your pupil, because then we're able to tell which like the measurements for your glasses, so they fit perfectly and you're able to see through them perfectly. Okay. Perfect. Okay, just keep looking where my nose would be. Good. All right. Okay. Perfect. So let me just take a look at your last prescription. Okay. So I'm looking here now at my notes, and your last prescription was a little bit less strong. So we definitely need a stronger prescription for you, okay? Yeah. So I'm writing down your prescription here on my notes, and you will be able to pick out some glasses. We have a whole variety of glasses for you. But throughout the whole appointment, your color blindness test went well. Your pupils look good. Your eyes look really good. I'm not seeing any issues. Okay? Yeah. So everything looked perfect. Not concerned about anything at all. So you can go right ahead and pick out some glasses, or you can order them online. We will be sending you your new prescription. But yeah, the appointment is over. You did really, really good. Like I said, everything was perfect. Just a little bit of a change in your prescription. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening, okay? I'll see you next year for your yearly appointment, okay? All right. Bye-bye. Hi there, you're here for the eye scan and vision test, correct? Good. All right, I'm just gonna start by putting on my gloves, and we'll examine your eyes right away. So, have you had any changes in your vision recently? Okay, interesting. I'm just going to start off with just a light here, and I'm going to be looking deep into your eyes. I just want you to keep your eyes open for this portion. So just look at my nose. Good. And just keep looking at my nose. All right, can you look up for me? Good. Can you look down? Can you look left? And can you look right? Beautiful. Now, same thing, just try to keep your eyes open for this portion. And just look at my nose. Just looking at the other eye. Very good. Okay. Can you look up for me? Good. Can you look down? Can you look left? And can you look right? Perfect. Yeah, your eyes look good. I'm not seeing any redness. I'm going to take a different light now. This one's supposed to be a bit brighter, but it's a little light. I just want you to follow the light. Okay. Yeah, just follow with your eyes. Don't follow with your head. Very good. Now I just want you to look at my nose. I want you to tell me when you see the light enter your vision. Good. Good. You're doing great. Okay, look at my nose again and tell me when the light leaves your vision. Mm-hmm. Very good. Okay, we are all done with that light. I'm just going to start with getting your temperature quickly. So just relax. It's just going to go on your forehead. Okay. Good temperature. I just want to make sure you're not sick before we begin. Okay. So I am going to be doing some eye scans on you like we mentioned before. Let me just take our first eye scan tool. So this here, I need you to just look at my nose. Okay. All right. Now let's begin. So we just have a red color. Okay, so just look at where my nose should be. You know, the lights end up blocking it. Just keep looking at my nose, okay? We're just gonna keep scanning your eyes. Okay. Just scanning. Okay. We're gonna change the color. Okay. Now there's a little vibration. Okay. So it should be kind of warm for you. Good. Very good. Okay, now we have blue. Okay. Now we have red and blue. Just gonna keep scanning your eyes. Very good. Now we're just going to end with the red again. Perfect. Okay. Now we have some more scanning tools, but we will be doing those later. I'm just going to check out your eyes here. So I'm just going to put this on your face. Okay. Tell me when you see the light. Good. To your other eye. Okay, tell me when you see the little baby lights like this. Okay? Good. 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 Right, let's move on to the other eye. Okay. Tell me when you see the little lights. Oh. The flashlight just died. Okay, but you did really good. That was perfect. I want you to look at my nose again, and I want you to tell me how many times you see this red light, okay? Just look at my nose. Very good. Okay, I want you to tell me if you see the light on the left or the right, okay? Keep looking at my nose. Mm-hmm. Perfect. Okay. We are going to be looking at your eyes with this red screen. Let me know when the light turns white. So right now it's like an orangey color, right? Okay, tell me when it turns white like that. Okay. Good. Good. Let's switch it. Let's do this side. Yeah. That might be a little tough for me. All right, ready? Good. 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 Oop. Good. 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 Perfect. We are going to be doing a color deficiency test now. What number is this? What number? 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 Do you see a number here? How about here? How about here? And then, how about here? Good. Do you see a number here? How about here? seen any issues with your color deficiency, so no color blindness here. I'm going to be covering one eye. Tell me how many fingers I'm holding up. Good, good. Good. Over here, tell me how many fingers I'm holding up. Sorry, I'm overthinking it. Very good. Okay. Now I want you to follow my red light with your eye covered. Okay. Just follow it. Just follow the light. Follow the light. Okay, now tell me when it blinks. Good. 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 Okay. Let's do the other eye. So just follow the light. Follow the red light. Okay, tell me when it blinks. Good. 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 Okay. And we're gonna do another scan here too. Just keep your eyes open for me. Okay, just follow the light. Follow the light. Follow the light. Good. Perfect. I'm going to be testing different lenses on you. So, let me know if you can see the letters. Good. Okay, let's do like a different prescription. How's that looking? Okay, interesting. How about here? Okay. And here, it looks better. Okay. And here. Okay, what's the smallest line you can read? Okay. Very good. All right. We're just going to go back and forth between different lenses. So, lens 1 or lens 2? 1 or 2? 1 or 2? Okay. Interesting. Okay, so lens 1 or lens 2? 1 or 2? 1 or 2? 1 or 2? Okay. Lens 1 or 2? Sorry, lens 1 or 2? So this one's really zoomed in. Okay, let me try this one. Lens 1 or lens 2? 1 or 2? 1 or 2? 1 or 2? Okay. Lens 1 or 2? 1 or 2? 1 or 2? 1 or 2? Interesting. Okay, so your prescription has stayed the same. So I'm just going to look at your eyes a little bit deeper with this here. Let me just turn the light on quickly. Okay, so just stay still for me, alright? Just gonna be looking at your eyes. Okay. Good. Okay, I'm just gonna use one light. Just look at my one light here. Very good, very good. Okay, turn that light off. Okay, look at this light here. Let's make it a little less bright. Look at this light here. Very good. Very good. Okay. Just want to get a deeper look at your eyes. I'm gonna just measure your eyes. Good. Just do another scan here. Okay. So this one's kind of like taking a picture. So just look straight. Okay. Just look straight. Beautiful. Okay, that is all for our test today. So we were able to do a vision test and eye scanning on you. Your eyes look very, very healthy, nothing to worry about. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. Alright, I'll see you around. Bye-bye. Hi there, today I'm going to be doing a super detailed eye exam on you. Just going to use my light, and I just want to see how your eyes react to the light. So just keep looking at my nose. Good. Very good. Nice. Okay. Does the light feel kind of bright for you? Okay. Very good. Okay. How about if I get it closer? How does the light feel? Is it too bright? Okay. How about on the other side? Okay. Very good. Can you follow my light? Just with your eyes. Good. Very good. Can you tell me when the light enters your vision? But you have to keep looking at my nose. Okay, let's begin. Very good. Okay, tell me when the light leaves your vision, and you have to keep looking at my nose. Okay, let's start here. Okay. Good. Mm-hmm. Good. Good. Okay, we're gonna do the same thing, but I have this red light, and I want you to tell me when you see it blink like that through your peripheral vision. So you need to keep looking at my nose. All right, so just tell me when you see that red light. Good. Very good. Okay. Very, very good. You did great there. All right. Now I'm just going to cover one eye. Good. Now look at my hand. All right. Now tell me how many fingers I'm holding up, okay? Good. Very good. Good. Now let's do the other hand, or the other eye with my other hand. Ready? Okay. Good. Now let's do it with both of your eyes, okay? So, let's try here. Ready? Oh. Okay, let's try over here. Okay. Good. Okay, now let's try with the light, okay? So I'm at the light here, and I want you to look at my hand, okay? Okay, ready? Okay, now let's try this side with the light. Ready? Good. Okay, now I just want you to follow my instructions. So I want you to look at my light. Okay, now look at my nose and my finger. Okay, now look at my light. Now my finger. Look at my nose, the light, my nose, my finger. Look at my nose, my finger, the light, and my finger, and the light. Look at my nose, my finger. Okay, the light, my finger, and my nose. Very good. I'm just going to take a look at your eyes with this tool here. So just keep your eyes open. I'm just going to get kind of close to you. All right, so just keep your eyes open. Right? Look up for me, please. Okay, now look right. Okay, now I need you to look down, left. Good. Okay, let's look at this eye. Okay. I need you to look up for me. Okay, now look down. to test something quickly. So I have this tool that blows air. I'm going to be putting it really close to your eyes, and it's going to blow air in your eye. I just want to see how your eye reacts to it. So you have to keep your eyes open. Don't blink, okay? Just keep it open. Don't blink. Okay, ready? Good. Okay, we're going to do the same thing on this eye. Okay, so don't blink. Good. Let's do it one more time. All right. Keep your eyes open. Don't blink. Good. It's right here again. Keep your eyes open. Don't blink. Perfect. Okay. I am just going to put on some gloves here. I am going to be touching your eyes, just seeing if there's anything going on. So like any bumps, lumps, anything like that. So just relax. Do you feel any pain when I touch your eyes? Okay, interesting. Okay. Very good. Okay, I don't think I need my gloves for anything else. I'm just going to take them off now. I have this light here. It's a little different. Okay, so it's a red light. I want you to follow the red light. Okay, good. Very good. Very good. Very good. Okay. Tell me when the red light enters your vision. Good. Great. We're going to keep using the red light, so I'm just going to put this tool over your eyes. Okay. Let me know when you see the red light. So it's covering your eyes, and there's these little dots that can see these red dots, these red lights. So let me know when you see it like that, okay? All right. Good. Okay, let's do the other eye. Good. Good. Perfect. So, this one's a kind of a different test. So, I have this red little screen here, and I have this. So I'm just gonna power it on. Okay, so let me know when you can see the light exit this red screen. Okay, you want to kind of see like a blue light. All right, let's begin. Okay. Good. Right. All right. Very good. You did perfect. All right. Now, I'm just going to check your vision. I'm going to put this pretty close to your face. All right. So I just want you to read the letters out to me. Okay. So let's start with this letter right here. Good. Good. Mm-hmm. Okay. Now that we did those, I'm just going to cover your eye, and I want you to read the smallest letter that you can, the smallest row that you can, okay? All right. So here you go. All right. Yep, go ahead. Perfect. Okay, let's do the other side. Right. This one's just a bit blurrier. Interesting. Okay, so that one's a little bit harder to read. Yeah, that's pretty consistent with what your prescription was before. So, pretty normal that that's happening. Okay, let's see. I'm just going to take this measuring tool and I want to measure your eyes so we can see. Let's see. It's like kind of a ruler. Like that. So I'm just gonna kind of see where your eyes are at so we can just try a prescription of glasses to see if that kind of helps when you're reading the letters to me. I'll measure your PD quickly just to make sure we get the right glasses for you. Just want to double check that you still have the correct prescription. Okay, let's see. Alright. Interesting. Okay. So I have some glasses for you. Let's put them on. I'm going to cover your eyes and I want you to read the smallest line you can again. Okay? One moment. Same thing with this eye. Just read the smallest line. Okay, so it does look better. Very good. Let's read the smallest line. Perfect. Okay, so it looks like your prescription stayed the same. So nothing to worry about there. But I need you to keep those glasses on. We're going to do a color deficiency test. So, what is the number in the circle? Here, 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 and 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 here. Okay, now I want you to trace your finger all the way across from X to the other X, okay? Alright, let's begin. So start here. Good. Very good. Now, let's take off those glasses for you. Great. Okay. So those glasses felt pretty good, right? Yeah. So, I'm assuming your prescription's the same. I'm just going to end this examination, just testing your sensitivity again. So I'm just going to put some gloves on. Sorry, I should have did this one earlier. So I have this little hammer, and I'm just going to press it against your eyes. You can close your eyes for me. And then I have this tool here. So it's going to spray some liquid, just very gentle. Okay. Yeah, it's just like very tiny drops. To the other side. Perfect. Okay. Yeah, everything looks good. Let me just wipe off that liquid. Okay. So everything looked really, really good. I didn't see any issues with your eyes. Your prescription stayed the same. Everything looks fantastic. But yeah, that's the end of the eye exam today. Thank you so much for letting me examine you. You're an amazing patient. But yeah, it was very lovely to meet you, and I hope you have a lovely rest of your evening. All right, bye-bye. Hi there, welcome in. So you are here for your glasses appointment, is that correct? Okay, great. So these are new glasses. So you've had glasses before? Okay. So I'm just going to start off by taking a look at your eyes, just making sure that everything is okay. All you have to do is look at my nose right now. Very good. You have very beautiful eyes. Okay. I'm just gonna get a bit closer and I'm going to lift up your eyelids. All you need to do is listen to my instructions, okay? So I need you to look up for me. Okay, good. Now look down. Look left. Now look right. Beautiful. Now we're going to do the same thing on the other side. I'm just going to lift up your eyelids. Great. Okay. I want you to look up for me. Good. Look down. Look left. And now look right. Perfect. Okay. Your eyes look good. Nothing concerning there. Okay. So now I'm going to take my other light. I want you to look at my nose and just tell me when you see the light enter your vision. So we're just going to be checking your peripheral vision right now, okay? All right, so just let me know when you see the light. Keep looking at my nose. Good. Very good. Very good. Okay, we're going to do the same thing, just with a different color light. Just keep looking at my nose. Whenever you see the light. Good. Okay. Now, can you follow this light? Very good. Just keep following the light. Just keep following the light. Fantastic. You're doing really good. Okay, now we're going to do the same thing, but with this light. So I need you to just follow this light. This one's a little bit brighter. So after we've done all these tests so far, do you feel like the light hurts your eyes at all? Okay, that's good. Very good. Okay, now I want you to just look at the light. Just look at the light. Good. Okay, now I want you to look at my nose. Okay, now look at the light. Okay, look at my finger. Good. My nose. Now my fingers. The light. Look at my nose. The light. My fingers. My nose. The light. My fingers. Good. I'm gonna cover one eye now, and I want you to tell me how many times you see the red light. Okay, let's begin. we're going to move on to a couple more tests and then we'll start with your glasses. So we're just going to do a color blindness test now. I want you to tell me what number you see, and let's begin. What number is that? Good. What number? 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 Okay. What number? What number? Very good. Now I want you to place your finger right here, and I want you to trace the line. Okay? Trace the line. Ready? Okay. Good. Very good. Great. Okay. We are all done with the color deficiency test. You did amazing. No problems there. Okay. Now, I'm just going to cover one of your eyes. All right. Tell me, what is the tiniest line you can see? Okay. No, so it looks pretty blurry. Interesting. Okay, let's do the other side. So read the smallest line. Okay, so it's also pretty blurry for you. Interesting. How about when we don't cover your eye? So I have this here, and I want you to read this letter. Good. This one. Perfect. Mm-hmm. Good. Oops, sorry. Good. Okay, so these two are going to be pretty tough, okay? Take your time, all right? Good, now let's do this last line. This one's going to be tough, okay? Now I'm going to be checking your eyeglass prescription. I'm going to give you a couple lenses. You're going to tell me which lens is better. So we're just going to see if your prescription has changed at all since the last time you're here. All right, we're going to start off with kind of a lower prescription here. So we have this, okay? So can you see any different with this lens? Okay, it's like about the same. Gotcha. All right, let me just go and check this one, okay? Then we'll do this lens. All right, so lens 1 or lens 2. So 1 or 2. 1 or 2. Lens 1. Okay. So now let's do lens 1 or 2. lens 1 or lens 2. Lens 1 or lens 2. Okay. Let's see here. Lens 1 or lens 2. 1 or 2. 1 or 2. Okay. Just wanna check. Okay. I'm just going to cover one of your eyes here. Okay. How does that look on the side? Any different? Kind of blurry. Okay. What about with this lens? Is this any better? It's a little better. Okay, how about with this one? Okay, good. Let's try this other eye. Okay, how's this lens? Okay. I'll try this one. Okay. Let's try this one. Okay. Gotcha. Just wanted to see if there was any difference between the two eyes before we continue. We're gonna try this one, and we're gonna try this one. Okay. Lens 1. What does it look like? Very, very blurry. Okay, how about this one? Okay, so this one's also like zoomed in as well. Interesting. Let's see here. How about this one? Yeah, kind of zoomed in. And this one? Interesting. Okay. Okay, so lens 1 or lens 2. 1 or 2. 1 or 2. Okay. Okay, now I'm just going to these two. Okay. Lens 1 or lens 2. 1. Sorry, actually, this is 1 or 2. 1 or 2. Okay. Take a look at these two together. Okay, what does that do? So it looks a little stretched, right? Okay, and there. Let's see this. So I'm going to take this one. Okay, so one of the zoomed ones. Okay, tell me what happens with this. Okay, interesting. Okay, so what I'm looking at here, just putting this back. If it fits, what the heck? Okay, so what I'm looking at here is this is your prescription. Okay, so it has gotten a little weaker, your eyes, so we had to go a little bit stronger. Not a big deal, happens quite often, especially with me. I wear contacts and glasses. My prescription changes all the time. So now I'm going to measure your face, your PD around your eyes, and we're going to pick out some glasses for you. So we're going to start off with your PD. So I have this tool right here. I just need you to look at my nose, and then we can begin. Okay, just look at my nose, and if this blocks my nose, just try to picture where my nose would be, okay? Just keep looking there. I'm just gonna measure. So my nose should be around this area, so just keep looking there. Okay. Okay. Mm-hmm. So I'm just measuring the distance between your pupils so that when we get the glasses, we can add that number. And it's very important because then you kind of see a little wonky if we get the wrong number. So just keep looking at my nose. You can blink as many times as you need. Looking like 35. Yeah, so it hasn't changed since last year. It doesn't necessarily change all that much. That's good that we're able to get that. Now I'm going to measure your eyes here. Okay, just keep looking straight at me. Try not to move. Okay. Now we're going to measure one more time with this tool. Now, since we were able to do that, I do have some glasses that are ready with the same prescription, same PD, all of that. So you just need to try them on. So first off, we have these here. Let me just clean the lens quickly. So these kind of give that like Ray-Ban feel. This is what they look like. Just black. They have like two little dots right here. So let's just put them on you. Okay. So how's that? Okay, yeah. They look really nice. Take them off now. I have a couple more pairs. So we have these. They're like a pinkish purple with gold right here, and yeah, they're really cute. A little bit different. This is a lot thinner, and they have kind of like a cat eye at the end, just a little bit. So let's try them on you. Okay, what do you think? Yeah, they're really cute. Yeah, I really like them too. Do they fit well? Okay. Alright, let's just take those off. Good. Okay, we have two more for you. So, actually we have three more. So this one's kind of unique. This is one of our newer ones. It has this little silver half circle at the nose, and it's really pretty thick right here, a little bit thicker than that last pair we had. So it's kind of giving the vibe of the first one, just a little different right here. Let's try these on you. What are you thinking? Yeah, I honestly think they look really good. Very unique, very different style than the rest of them, especially with that little circle there, half circle there. Yeah, they're really cute. Let's take them off you. Good. Okay. Now, this one is a bit different than the rest. So let me just clean the lens for you quickly. So these are a really pretty, like rose gold, very thin around here, but I think that's pretty much the style that they're going for. Even though they're thin, they're pretty sturdy. These are really, really cute. Over here, they have a little bit of like a plastic cover, so that's not like irritating your ears when you have them on. Yeah, let's put them on you. What do you think of these? Yeah, they're super unique. They're really beautiful. I think they're really cute. I love that rose gold pinkish color. I think they're adorable. Yeah. Do they fit good? Mm-hmm. Okay. Nice. Okay, so we have one more pair. So these ones might be my favorite. So they're honestly like pretty thick and they honestly look really nice. I have this pair at home. They also have those two little dots here, just like those first glasses we tried on. But these, I don't know, I really like how thick they are here. They give, they're really like sturdy, thick right here as well. So, yeah, these are from Diff Eyewear, it says. They're Weston BK6762. Yeah, they're really, really cute. So let's just try them on you. Okay, very good. All right, what are you thinking? Yeah, for the bigger glasses, it's kind of nice because it fills up like the whole area, so you're not getting like half of your eyesight cut off. Like sometimes I have trouble with glasses that are a little smaller. Yeah, they're really cute on you. You look amazing with those. All right, let's take these off. Perfect. Okay. Yeah, those are the glasses that we have available in your prescription, in your PD measurements, all of that. So you could go home with these, or you can just wait and look at different styles and we can put in an order for you. Okay, so yeah, they were all very, very nice, and I can see why you're having trouble picking one. Which one do I think you should get? Honestly, I think the last one was definitely your style. These are really, really cute. I think these are the ones for you. Yeah, you could definitely take them home today. They're ready. They are perfect fit for you. Perfect prescription as well. So you can go ahead and go home with these today. Okay, so that's what you want to do? Alright, yeah, definitely we can do that for sure. And thankfully your insurance covers it 100%, so we won't need a payment for you today. Yeah, so today we're going to be sending you home with your prescription, your updated one, just like a form. So if you want to shop around and get glasses online, you can do that as well. And I think that is about it. There were no issues with your eyes. You looked really, really good. Not concerned about anything. And we will be sending you home with the glasses. Alright? Yes. But it was very lovely to meet you, and I hope you have a lovely rest of your evening. Alright? Okay, I'll see you next year.